everybody. Today we're going to be talking about pediatric chiropractic care, and for starters I want to talk about why we might bring a child to see a chiropractor. And this is something that a lot of parents think about, but they're not always sure as to why they might go see a chiropractor with their baby. So the most common conditions that chiropractors see with infants and toddlers is colic and occasionally ear infections, and then sometimes parents will just bring their babies in for a checkup because labor and delivery can be kind of tough on a baby's spine, and as is the first couple months of life, you're just the baby is just laying there very statically and not moving very much. And just like in an adult, if you lay around all weekend, a lot of times you are stiff after that. And so those are the primary reasons that we see infants in the clinic. So parents are often intrigued about chiropractic care for infants. However, they're a little anxious about it, and that's understandable. So we wanted to take a little bit of time to demonstrate some of the techniques that we might use on an infant. And so we've got a healthy little infant here, Juliet, today, and we're just going to demonstrate some of the stuff that we might do on an infant. So we're going to take her here today, and the first thing that any chiropractor would do is assess her spine. And assessing her spine can be done in pretty much any position. So while holding her, I can just run my hands or thumbs up and down her spine, and we can see areas in her back that feel tighter than others, where there's not as much motion in the spine. And these are the same areas of the spine that we see a problem sometimes with adults. And so we as adults often think that only adults experience spinal dysfunction and or spinal pain, and we've all had neck pain or low back pain, but so can infants and toddlers. And so like we already mentioned, the beginning of life is stressful, physically stressful, and so and that can cause toddlers a number of problems. If an adult is uncomfortable, it's hard for them to sleep. If a baby is uncomfortable, it's hard for them to sleep. And so there are things that we can do with infants that help them be more comfortable and help them have better spinal function. Occasionally infants will have a condition called torticollis, where they're holding their head off to the side. That's strictly a biomechanical problem, and that's a biomechanical problem that we can address. So colicky babies, torticollis, and ear infections are things that we see frequently. So after the chiropractor has assessed the baby's spine, again, we would just do that by running our hands up and down her low back and at her neck. The chiropractor will then perform several different types of techniques to address some of the issues, and those include both soft tissue techniques and spinal adjustments. And that's where the majority of the anxiety comes in with parents, and their concept of what an adjustment is sounds pretty scary for an infant, but you will see that it actually is very subtle, and she won't mind at all. So I'm just going to demonstrate some of those techniques right now. So if we had a baby with torticollis, another thing we would do is look at her in both what we call a supine position and look and see, is she holding her head to one side? And we would observe it for 10 or 15 minutes, because right now she's just holding her head to the side, but she's doing it voluntarily. In a child with torticollis, they can't control it, and so it would be held off to the side continuously. And so, but she's doing it voluntarily. We would then flip her over onto her tummy. And again, we would do this for longer than just a couple seconds, and we would observe her posture and her motor control. And if they're a toddler, certainly we would watch them walk, watch them crawl. And even newborns, you can observe motor control. And so we can see a lot just by looking at the infant or toddler, and then again we can palpate and feel if there are any areas of dysfunction. And that's the soft tissue component. As far as the bony component of the spines, we do infant and toddler adjustments, but they're very, very subtle. And so I'm going to demonstrate a couple of those right now. We can both use our fingers and our hands for those adjustments. And we can also use low pressure tool-assisted adjustments. So low-force tool-assisted adjustments I'll demonstrate in a second, but for starters, I'm just going to demonstrate how we would adjust the thoracic spine in an infant. So she's an infant here, and we would hold her a little bit, and that was it. And you weren't able to hear it. You might occasionally hear a little bit of a click, and that's normal, and it's not scary, and she didn't mind, obviously. And you might experience that when you pick up your infant or toddler. You might hear or feel some pops in their back, and that's nothing to be alarmed about. That's normal. So now I'm going to demonstrate how we adjust both the lower back and the upper part of the neck in an infant or a toddler. We use this particular low-force instrument is called an activator, but there are a number of low-force instruments out there. It looks intimidating, but it really isn't. It makes some noise, which often will get the baby's attention. And what it does is it creates a very quick but very subtle thrust in the spine, and that creates movement in the joints that are restricted. So we can come down on her pelvis and feel that her right SI joint actually needs a little bit of a realignment or an adjustment. And then we do this, we get her attention with it, make sure she's used to the sound, and then we do a little adjustment, which again, you can see she doesn't mind at all. Occasionally, with the first time we do it, we get a startle response, or the infant or toddler will cry a little bit, but it's because it scares them, not because it hurts. And this is certainly something that when parents bring their children into our clinic, we demonstrate it first on the parents so they get to experience what it's like. And we use the same tool for neck adjustments as well. Another low-force technique, and the last low-force technique that we use, again, is just with our fingers. And it is a much slower process, and it's a repositioning technique that we use both gravity and some counter force. So right now I'm working on the right side of her upper neck, and she's smiling because it feels good. And the beautiful thing about treating infants and toddlers is that they respond very, very quickly to care. So typical course of treatment for an adult might be 11 or 12 visits. It might be 20 visits depending on what condition we're treating. For infants and toddlers, almost universally, it's 2, 3, or 4 visits, and we resolve the condition. So infants and toddlers respond very, very quickly to care, and that's pediatric chiropractic.